Welcome to the Chronic Spoonful podcast, where we discuss real life with real chronic illness. Each week, we'll cover an aspect of real life spoonie living and what that can mean for different chronic illnesses. We hope this will be a place you can go for updated spoonie info and where you'll find humor, because, we're a little crazy, important information, and community. As a disclaimer, we just want to remind you that yes, we'll be talking about chronic illness and health information, but we are not your doctor. Everyone's chronic illness is different, and we are absolutely not MDs, so we are not qualified to give you medical advice. We're going to tell you unequivocally to discuss anything we talk about on this podcast with your doctor.
All right. Okay, everyone. Welcome back to the Chronic Spoonful podcast. We are so excited to be talking to you today, and we have a very special guest. We have Jean Marie, who's going to talk to us about something I wanted to talk about for a long time, which is Lyme disease and chronic illness. I think people have a lot of misconceptions about Lyme disease. People don't even realize it can be a chronic illness. And so Jean Marie is going to talk to us about it, and we get to ask her all the burning questions we have inside about this, and how, she lives with this chronic illness and its diagnosis and everything else. So welcome, Jean Marie.
Hey, everybody.
Hey, so tell us a little bit about yourself and Lyme disease and how it's affected you.
Well, my journey started back in the 2000s. In the early 2000s, I was a professional stage manager on the East Coast, mostly metropolis of Manhattan, so maybe about half an hour north. I did a lot of community, regional, college theater there, and I ended up stage managing an international music festival. And I was not a country bumpkin. I'd originally been born in Yonkers, so I was a city girl that kind of got thrown up into nature. Yeah. And about halfway through the music festival, so it was the end of July, August 2006, I felt like what I thought was a bee under my shirt. And I was with two other people that worked the music festival, and I started acting as if like a bee was stinging me. It was like a moment of pain. And I said, I'm going to be inappropriate. And I lifted my shirt to see for them to like scoop the bee out or whatever it was. And both of their faces just dropped and turned to ashen. And I had a 6 to 7 inch EM rash on my torso with a big center inflamed. And it just like touched my shirt the wrong way. And I had no idea I had that. It was a music festival. I probably hadn't showered in 3 days. I hadn't, done a body check. I didn't even know about ticks at that point. And they
you were living in the city.
They had no idea they knew, but it wasn't a welt from a wasp or anything like that. It was, I immediately called my mom, who was a registered nurse, and she goes, we know exactly what that is. You need to get to the doctor and get tested. So I went to the doctor, but with Lyme disease, it gets complicated because if you go to the doctor too soon, the test will always come back negative.
Okay.
And because of the way the medical journal is written, especially back in 2006, they weren't going to treat you unless you had the positive test. So it was kind of that catch-22. So I got the traditional 4 weeks of doxycycline. He agreed it looked like the tick rash. He said, well, wait back for the test. It'll be fine. And then for the next 4 weeks, it was living hell. It was falling asleep at work at 2 p.m. on the desk, like head on the desk, people walking into the office and I'm asleep. Barely being able to walk, having chronic fevers, chronic sweats, confusion, not being able to drive home after a work shift, things like that, more and more pain. And at the end, the doctor called me back and he goes, good news, it's negative. And I said, okay, great. What's next? And he goes, I don't know what you mean. And I said, what's next? Because I'm getting worse with every dose of doxycycline. I'm getting worse. Yeah. So something's still wrong. What do I do next? And he goes, well, it's negative. And he basically hung up on me. Like dial tone. There's nothing more I can do, dial tone. And that was the doctor.
Gosh.
So what do you do? So I immediately
looking up Lyme disease.
Mm-hmm. So I found a local LLMD, and I'm going to try to get through the podcast without saying his name, but he's a famous New York East Coast doctor, but he only treats with antibiotics. He does not, at the time in 2006, he didn't even if you want to do vitamin C, that's on you. Just let me know what you're taking. Like he had no herbal remedies, no supplements, antibiotics, that's it. And I went to him for over 4 years.
That was a big thing back then, though, too. Like, they didn't
Mhm.
believe in any supplements. They didn't believe in naturopathic medicine back then. I think a lot of doctors were avoiding it, to be honest. They would only give you pharmaceuticals.
Yeah. And they really didn't know what they were doing with it.
Right.
I'm so glad that we've been blessed with more research and more people that are willing to kind of pave the way for that.
I agree. So you saw him for 4 years.
Mhm.
What did he do in those 4 years to help treat you? Did he diagnose you with the Lyme disease? Did he?
He did diagnose me with the Lyme disease. We went through a bunch of questions. He said it's clearly that there's co-infections at the same time, because just be aware that it's not just Lyme disease. So even if you take the doxy, odds are there's something else in that tick. I believe in one of the most recent researches that there can be over 200 different types of parasites and vectors inside one tick bite.
Oh my gosh.
So
Wow.
there's the 5 or 6 that they test for, and I've for, I don't know what it's called, but when they go through your head to toe symptoms and they kind of divvy up what columns each things fall into. I had Lyme disease, Babesia, Bartonella, and then later on in this timetable, I also had anaplasmosis, and they're not sure if that came from a second tick bite later, because that I wasn't diagnosed with anaplasmosis until 2013, and it was like a new hit of symptoms. So I was like back in bed. It was a whole new thing. So they said it's possible that you got bit again by, a tick or a mosquito, and you got a new case of anaplasmosis.
Oh my gosh. Wow.
Because I went into a different doctor. We're going to skip timeline. I went into a different doctor and I said, this is Lyme disease, but it's not Lyme. Like, I've never had this before, whatever this is. And it turned out that it was anaplasmosis, which is also a tick-borne vector.
Oh my gosh. So they don't automatically test for that when they see a tick bite?
No.
Okay.
No. And there's when you go in, like if you had a tick and you removed it, they usually don't even test at all. They just give you a week or 2 of doxycycline and say, okay, come back if you don't get better, which it sounds horrific, but that's probably the better way to do it, because it takes weeks for your body to make antibodies, and that's what they're testing for. So where it gets into that rocky water for people that are immunocompromised and don't know it is that if they're only testing for antibodies, you might not ever have them. Not ever have them. You might not ever have them.
Nicole knows about not having antibodies and B cells and all that stuff. She goes through all of that.
Yep.
Yeah. So if you don't ever have a reaction, your IgG is never going to blip that you were bitten. But you could be symptoms. And I clearly was bit by a tick. I mean, I know you guys can't see me on the podcast, but it was like my whole rib cage.
Wow.
Like from boob to almost my hip, like was the EM rash, which is the classic bullseye with the center and the white and everything, the rings and everything. So, I mean, as a medical doctor anywhere in the United States, how can you look at that and tell the person they don't have Lyme disease?
Yeah, because
like, how can you see that and be like, oh, we're still questioning it?
I agree, because that's like the classic sign. Yeah.
And only like 40% of people get that. So you can't even use that as the textbook, because so many people get everything else and just not that rash. They don't react in that way.
Oh wow.
That's kind of scary.
Yeah.
Because I was always told growing up in the Midwest, you are always told to look out for ticks, check your body for ticks when you come inside. We used to hang out at a lot of forest preserves. And, so you were always checking each other, like you'd see the monkeys in the zoo checking each other. Well, that's what we did. We'd go through our hair and check our bodies for tick bites, and ticks themselves, and especially owning dogs. Ugh, so many ticks. But we were always told, look for the rash. The rash is going to be the sign. And now knowing that it's only 40%, you've got to look for other things. Scary. So you saw this doctor, he gave you antibiotics, they found all these things. Then were you getting better, or were you continuing to just get worse, or status quo?
I would get better, and then you would plateau, and they would see what symptoms were left, and he would check up he would change up the medicine. So I would always be on 2 antibiotics and an anti-parasitic at the same time. And there was always an antibiotic that could jump the blood-brain barrier. So to prevent neurological Lyme, because I was having neurological symptoms. I was forgetting words. I lost short-term memory. I was having issues with replacing words. If I was too fatigued, it was as if I was drunk, where my significant other would have to pick me up after, a 10-hour work shift and leave my car there because it was like I was drunk or hungover and couldn't drive. And there was nothing wrong with me. Like, I hadn't been drinking. I wasn't diabetic. I wasn't going into sugar coma. But I would be like blurry vision, headache, not able to concentrate, shaky. And it's like, you can't get behind a wheel, like, if you're like that. So,
No.
And again, like, I wasn't being dramatic. I'm unsafe. Like, I can't get behind the wheel and drive 45 minutes home. Come get me. That's
better than you actually going, I'll just suck it up and try to drive. Because
there was no sucking it up.
You can't, like, you could have hurt somebody.
Yeah.
So, yeah.
At my worst, I was hiding. I worked in theater. So I worked for a very good theater. They know who they are. Where they said I could do anything as long as I wasn't on camera. So there were days I had to go to work. I was a young mom. I had to pay for my therapy. I didn't have insurance for the first 3 weeks. And I had to pay for it on my own. So it was a big thing. I got Medicaid, sorry, because it was New York. But I would literally fall down behind the curtains and lie in a ball if I didn't need to do anything. Like, if I didn't have a task and I wasn't doing lights and I wasn't doing sound and I didn't have any tasks and the client was happy, I would literally fall down behind a curtain and curl up in a ball and wait for somebody to tell me that I needed to do something. And they just said, don't be on camera. Just be safe. Just don't be on camera. It was so painful and so exhausting. And this was during treatment.
Yeah. Well,
So
I don't think people understand how physically draining it is to be a stage manager. I've done stage managing for events, and it is draining. And you're constantly, what's my next assignment? Where do I need to go? Who do I need to get? What do I need to do? And so that, on top of all the Lyme disease symptoms, I can't even imagine how you're remotely functional.
Yeah. So at that theater, I wasn't a stage manager. I was just a stage hand. So I was part of a team. But the acceptance of it was amazing, because part of my treatments, when we plateaued from the antibiotics and the antiparasiticals, and I got to a certain point and I didn't get better, we switched to IV therapy, which was in the office every day. So it was about a 45-minute bag of liquid medicine IV'd into a port in my arm, and it had to be every day in the office to be covered by insurance. So it was just like a $20 copay. So that was a blessing, but it made me late for work. If my call was 8 a.m. or 7 a.m., I had to do that before, because the office would be closed by the time I get out of work. So I was constantly late to work. I had permission, but try to walk into a team of 20 or 30 people and you're the only one that's late, things like that. And it was very like union mindset of like, they would wait on the dock for the person that closed their car at 8:01, like that kind of thing. Like, it was that kind of workplace. And so if you're the woman, the young woman who's always late, that was a very uncomfortable place to be for a while, because
I'm sure,
they don't need to know my business. They didn't need to know that I was under this treatment. Most of them did. But it's just very difficult trying to hold your own and stay employed when you can barely function.
Very true.
Let alone as a woman, which is probably a whole nother podcast, but
yes, you're right. Well, I mean, there's a significant percentage of people diagnosed with chronic illness are women. I think it's well over the majority.
Yeah, I think it's like in the 72% or something like that.
Yeah, somewhere between 70 and 80% is I remember the last time I looked, but I don't want to be quoted on that because I don't know for sure. But I think it's in that percentage. And so that's really hard, because women are already looked upon differently in the workplace. And you're right, that's a whole other podcast. But now you've got the people looking at women differently in the workplace, and the chronic illness. It's kind of making you late, making you not be able to do certain tasks. And that becomes really rough.
Before the rise of all this social media and before TikTok, and but Facebook was barely a thing. Like Facebook was on the upswing, or Meta was on the upswing. But the advice for women who were sick was, before you go to a new doctor, don't shower, don't look pretty, go in pajamas. Like,
That's right.
Make a physical representation of how you feel and how you can't do
Absolutely.
self-care. Because
Mhm.
every person I know would take a shower before going out and would put on the minimum makeup for their own, to like say, I got to do this, and they would look presentable. And you just can't to be taken seriously. You have to show them at your worst and say, this is it, and help me.
I mean, I've had doctors, because I tend to have that customer service peppy mentality, you know, when I go out places.
Mm-hmm.
I've had doctors dismiss me because I seem too happy and too normal to be sick. And it's not until I start yelling, or like, well, what other people call yelling, I don't think I'm yelling, but I think I'm being very firm. It's till I start pushing back really hard or actually start to cry that they finally take it seriously. And I'm like, why is that making you take it seriously? I'm telling you how I can't live my life.
Mm-hmm.
But it's, unfortunately, they're looking for some emotional response. And I mean, I went to my grandfather's funeral and someone asked me how I was. I'm like, peach keen. And I'm like, wait, why did I say that? And I'm like, oh my gosh, I'm way too used to customer service.
Mm-hmm.
It was just something that came out of my mouth. I think you were there, Nicole. I was like, I'm doing great.
We build walls to exist, because I was trying to explain pain tolerance to someone, that it, like, the pain scale is 1 to 10, and somebody said to them that their pain was a 14, and they're like, that's impossible. The scale is 1 to 10. And I asked them, and I was like, haven't you ever been at a 10 and then still had to do something? 14 is what happens to the 10 after you did the thing that you were not supposed to do.
Mhm.
And that is our daily life. Like, when you get up at a 4 and you know by the end of the day you're going to be a 7, and you only go back to being a 5 when you wake up the next day, that's an endless cycle of elevation. And there's how do you get out of that? How
Exactly.
I don't answer the question when they ask me a pain scale. I'm like, don't ask me that. Ask me how my pain is impacting my life. And
I'm going to write that down.
And it's because I always say, your 8 is not my 8. If I'm at an 8, I'm curled up in a ball. I know what a 10 feels like. And like most days I'm at like what I consider a 4 or 5, and other people would be in bed. So I'm like, don't ask me that. Just ask me how my pain is impacting my life. Ask me what things it's affecting. That's going to give you a better description of what my pain is doing to me. This is very different than going to the emergency room and having a broken arm, which I never ask you what your pain scale is there either, but it's not like that. This is a chronic thing, and people with chronic illness dismiss their pain so much more often than people who don't. Like, other people, if they all of a sudden today felt the way I do, would be non-functional.
Yeah.
But eventually they would learn to do exactly what all of us just talked about doing, working through the pain, getting through the pain.
And the thing with Lyme and the co-infections is not to take anything away from anybody else's chronic illness, because we're all dealing with quality of life issues and pain issues and cognitive issues. With the Lyme and the co-infections, it's not always just pain. Like, their classic questionnaire is joint pain. Do you have muscle fatigue? Do you have this? I ended up having a heart attack by the end of this. Like, I had I tried to go in the ocean when my nerves were basically on fire, and it just felt like I was having 1,000 needles stabbing me all over. It felt like my whole body was asleep and got slapped in the face by a wave, kind of thing. I ended up having a heart attack, and they couldn't find what was wrong with me, and it was electrical, because one of the Lyme disease symptoms is myocarditis, and basically there's a specific part of the heart that's responsible for the electrical communication between the top half and the bottom half. And mine had stopped working so long, I had heart damage, which is basically it's a heart attack. It's an MI. I had scarring. I had the enzymes from the heart damage. And I'm 36 years old going, the only thing wrong with me is Lyme disease. And they kept asking me if I did cocaine.
Oh my
'Cause
gosh.
That's one of the only reasons that the healthy 36-year-old has a heart attack.
That's right.
And I'm like, I'm not a healthy 36-year-old. I have Lyme disease. And I kept trying to explain to them that I was never diagnosed with cardiac issues as a Lyme patient, but that doesn't mean that that's not what caused the heart attack.
Sure.
You know, and the other issues are cognitive. I was losing words. I was losing short-term memory. I couldn't learn new things. So like being a stage manager, when you have 5 new acts in a weekend, how do you greet them if you don't know who they are?
Yeah.
I get that so much.
Edit that out if you need to, but like really. So one of the stage hands that I worked with, I told him how scared I was of that, and he said, "Fake it till you make it." He's like, "Carry that clipboard around and just do the best you can, and you know we've got your back." And it's how do you do your job
write
if you
everything
literally
down.
don't? If you don't have cognitive function, how does anyone do any job?
That's very true.
No, they don't. It's a struggle. And I think that is actually a whole other podcast we need to do also, another episode of like, how do you function working when
you can't function? Yeah.
I mean, there's so many things that go into that, but I mean, yeah, Lyme disease is definitely, I've heard a number of people talk about the effect it has cognitively on the brain. And it's, as someone with EDS who took gabapentin, and it sent me deeper into cognitive issues than I should have. I hated it. I hated every second of it. You know, I couldn't remember words. I was stumbling over them. So when you say all those things, I'm like, oh my gosh, I kind of relate to that. Because I just couldn't think of things. I would sit there for a few minutes and I'd stop mid-sentence because I couldn't think of the simplest word in the vocabulary.
Yeah.
And it was terrifying for me. I'm like, what is happening?
Yeah. And the emotional dysregulation is really bad. I've gotten better at communicating. And I think I'm kind of in a remission where I'm controlling the inflammation with things like diet and alternative lifestyle and things like that. So I'm kind of doing my own way of putting my fight or flight at ease to ease my symptoms. But it was years of really tough communicating with my husband to keep that relationship going, because I had missed the first date with you guys for the podcast. And I had said, this is like, we should talk about this because it affects other people. Being this sick all the time, any chronic illness, and it involving physical weakness, unpredictability, mood changes, and just even temperature dysregulation about whether or not you want to go outside and feel the wind, that kind of thing. It affects other people and it loses relationships. I've lost friends who didn't understand it. I would have to explain to my husband while I was in it's literally called Lyme rage, you know, screaming at him over something so insignificant, going, listen to what I'm saying, not how I'm saying it. Like, listen to my words because the emotion is real, but I'm not presenting it correctly. Like, these are how we used to have to communicate because I wanted to stay married.
Yeah. But lucky for you, you got someone who is willing to work with you through that.
Yeah, 100%. So things like Lyme rage is completely real and you have no control over it at all. And so, you know, it's all these things that are combined that people don't understand.
Thinking about it, we're living in a hypersensitive world right now. Everyone is offended by everything. And I'm going, guys, can we focus on the big issues to get offended by?
Yeah.
But the fact that, like, when you say Lyme rage, I'm thinking to some people in my head of people I've known that even when you're firm, they think you're yelling at them. I can't even imagine what they would do in the face of Lyme rage. But, you know, you'd have to, it's like, I'm not meaning to scream.
Yeah.
But just deal with the issue we got to deal with.
I think I've only done it a couple of times in work, and it was back in the beginning. So it was like back in New York and back in theater. So New Yorkers take everything with a little grain of salt, but it was, you know, the looks I got from some of my coworkers was like, she's lost it. And I had lost it. There was no control over the level of frustration that I was feeling.
Yeah. And you don't want to have to wear a sign on you all the time that says, I have Lyme disease. Please be patient with me. Like,
yeah.
It's really rough.
And it's also hard because people, underestimate you or overestimate you. I don't know which upsets me more. I was stage managing a person and I was feeling horrible, and it was a cabaret, and she was visiting where we were. So it was the same music festival I got sick. So I think it was the next summer. So I was still in antibiotic treatment and things like that. And she started talking about, ticks and stuff. And I was like, oh yeah, I actually have Lyme disease and some other things going on. And she goes, how do you feel? And I went, I'm about, 75, 80%. And her jaw dropped, and she goes, I'd hate to see you at 100%. Because from her perspective, I was rocking it. Like I was, leading everybody, telling everybody what to do, being a great leader, stage managing, had a smile on my face, hospitality, customer service, as you put it, like to her, because she was the artist. And she just said, like, I'd hate to see you at 100 if this is what you think 80 is. And I was like, okay, I guess that's a good thing.
I guess it's a compliment. Yeah.
I'd rather be at 100 because I wouldn't feel crappy.
Right.
But,
that's really key. It's like, I'm glad you see it that way, but I still feel bad all the time.
Mm-hmm. Yeah.
Yeah. I'm trying to remember the last time I felt 100%. I don't know.
Right.
I don't know either. Maybe I might have been 10. That's what I think now. I'm like, I might have been around 10 or 11.
That's good level of self-awareness, though. That's
yeah. Well, I think chronic illness makes you look at yourself and be more self-aware, because you're always being asked, how are you feeling? How are you doing? What's happening? And, how's the medicine working? So you start to get almost sometimes hyper aware of of what's happening in your body and yourself, to a point where I think we are much more in touch with our bodies now than when we felt healthier, because we have to pay attention to even some subtle changes.
Yeah.
That happen to us, because you never know now if that subtle change is actually something pretty big.
Yeah.
Right? It's why I track a lot of my symptoms. It's why we created the planner that we did, is so people, because I can't remember at all anymore. I
love your planner, by the way.
Thank you.
I haven't gotten it yet, but I love your plan.
As long as you use it, it's amazing. I don't always remember to log stuff in it, but when I have a symptom, I'm always logging that, because then I go back to my doctor, especially my cardiologist, and I'm like, I had this, and this symptom, and some are very minor and some are bigger, but I've had a few of those minor things, like my resting heart rate went over 100 a few times in like a 4-week span for my Apple Watch. And he's like, no, we need to check that. And I'm like, really?
Yeah.
Okay. I just brought it up because I thought it was odd, but I just thought it was part of the issues I have with my heart that are related to the chronic illness. And he's like, they may be, but it could mean it's getting worse. And I'm like, because, you always want things that are wrong.
That's just what you want to hear.
Yeah.
But yeah, we just, and so I think we become hypersensitive to anything that's happening with our bodies. So they had you on all these antibiotics, you'd plateau, they'd put you on other antibiotics.
Yeah, so they would mix it up.
Is that just continuing now, or have they found other treatments?
No, it was for the first 4 years. So I did things like doxycycline, minocycline, amoxicillin. I was on 3 grams of penicillin for a while, which is 3 1,000 milligram pills. And I went to the hospital for something else. I think I had cut my thumb, and they were asking medications. And the guy actually had to leave and Google Lyme disease, because he was like, why are you on 3 grams of penicillin? And I was like, and I explained to him, and he had no idea. And he was like, okay. And he walked away and looked it up.
But at least he did that instead of just
100%.
missing it.
100%.
Yeah, good on him.
Yeah, they mixed it up with all these rifampin, Alinea, things like that. And then when I kind of plateaued, and he clearly saw that a lot of my symptoms were the Lyme disease and not the parasitic. He went to the IV ceftriaxone, which was, sitting in the chair for 45 minutes a day and getting an IV right into my arm. For like 3 weeks, we tried to do it at home because I didn't have insurance. So it was cheaper for me to just purchase the bags, like pay for the prescription myself and do it in a port. But there was always something wrong with the port. It was always slipping out and I'd have to go in anyway. So we just went to the office and it was better. But I did get to a certain point. I think it was the summer that I was, 80%. And I just had to call it quits and say, I'm going to try to do this on my own at home. And I started playing around with supplements and buying like Dr. Horowitz's books, things like that, to try to heal myself. I did a lot with diet. I did a lot with mindfulness, which is also probably another podcast. Somebody take notes.
Oh yeah, no, it's on our list of things to do because
there's the concept of like, right now everyone's talking about toxic positivity and how if you have trauma, that's not the way to go because it's, positivity doesn't erase all the trauma. But I was going to a holistic physical therapist in the late 2000s, helping me with lymph drainage because my system was completely overloaded with all the stuff that wasn't being filtered out. I couldn't filter it all out. All the stuff was dying and I couldn't get it out of my system. So I would go and get help. And she was really ahead of her time, reading books that nobody else was reading. And it was all about how part of chronic illness is our own mentality towards it. And some people, I did a TikTok, some people are not ready to hear that. I wasn't ready to hear that. I was like, not nice word. You're discarding my what I feel. And she's like, no, I'm saying it's very real. But we do have on a cellular level some control over our pain receptors and our happy chemicals. And sometimes you just have to start with that and see what kind of falls into place. And see,
she's not talking about toxic positivity. She's talking about kind of being realistic with yourself and healing yourself in ways too. It's there's a fine line sometimes, but it's not. There's a difference between toxic positivity and changing your mindset.
Yes.
Yeah.
She was definitely talking about changing your mindset, but the most recent things that I've seen is people are taking that as toxic positivity of like, oh, everything has to have a silver lining. And it's like, no, that's not what it's saying. It's saying that you're trying to talk your body out of the constant fight or flight. So you start processing your cortisol and your dopamine and everything as not always the sky is falling. And if once you start to try to change that part of the mindset, your body gets a moment of going, oh, my pain is now a 3 instead of a 5, like because it is no longer waiting for the truck to hit, like kind of situation.
And it's not, and like you said, it's going from like a 5 to a 3. It's not going to go from like, it's not necessarily going to take you from a 5 to a 0.
No.
I think too many people take it that way of that mindfulness.
And they don't even want to try because they think that you're ignoring the fact that they're in pain. And it's like, no, but you can make it a little better. You can, if you're willing to take all of these pills. There was one time where I posted my day was 56 pills between supplements, antibiotics, acidophilus, like probiotics, things like that. It was 56 in one day. And I was like, if I'm willing to take 56 pills, why can't I also try to enjoy the bird singing?
Exactly.
Yeah. Why am I so anti feeling nice? Like, why am I so fighting? Like, it's okay to also think about not being in pain. Like, you get stuck in that mindset of being sick that it becomes a part of you, but it doesn't have to be the only part of you.
Yes. Agreed. So you started doing that. How did the mindfulness help you? Like, what did it do for you?
I think that's why I'm able to focus on so many other things now. Because I'm taking care of 2 other people in my life that I love so much, and I have to keep it together for them. So it's kind of my own little mantra of I need to be okay to help them be okay. And it really got me to the point where I can keep my issues at bay in order to continue functioning, because I still have pain every day and I still get uncomfortable every day and I still have undiagnosed IBS symptoms and I have, an implanted heart monitor and all these things. So obviously my illness didn't go away, but the mindset really makes a difference of how you get up in the morning and you start to navigate everything. It really has made a difference.
Yeah. And then by being able to do that, I'm sure it improved your relationships at home too.
Mm-hmm. Very much so. Very much so. We're nauseatingly communicative in our house. People go bleh when they hear us.
Like, oh my gosh, we have to tell each other all that stuff.
Exactly. Oh, we do the like, I appreciate you, honey. Thank you so much for blah, blah, blah. Like we do that all the time. And it just makes life so much better because then you don't have to worry about whether or not they think you appreciated it because you said it.
Yes.
People
Yeah.
should say things more often. Like,
I agree with
It
that.
really makes a
Absolutely.
difference.
Yes.
Yeah, I forget sometimes, like when I'm in like a really stress out moment, I forget to say thank you. And I hate that I forget to do that
Mhm.
sometimes. Cause like 2 days later, I'll be like, oh my gosh, I didn't say thank you. And I'll suddenly like shoot off an email. Hey, I think I forgot to say thank you, but you did a great job or something. It's just
Yeah.
because people need to say it more often. People need to feel appreciated in
Yeah.
your life, especially the people that stick by you when you have a chronic illness, because like you said, you lose friends, you lose, like, family doesn't always understand. So telling people you appreciate them being there with you and helping you can really just make a difference in your life.
Yeah.
Yeah. So okay, so you did all that, like, and you're continuing to use all of that now. What advice would you give people if they identify with your symptoms or they're like, well, maybe I did have a tick bite? Like, what would you tell people about a diagnosis process? When should they get checked out for that? How should they talk to doctors about that?
I always try to tell people to really be informed before they go to the doctor because most doctors don't know about it. So if you go into the doctor's office prepared, going, this is the description of Lyme disease and the co-infections, this is the chart, and these are how many of my symptoms match up, I would like to be evaluated. And the key word is evaluated, not tested, because most people don't show up with testing. But according to the new medical journal, they have to do it symptomatically. They can do the testing, but they can't diagnose you based on a negative test. If you have 95% of the symptoms, they are allowed to treat you as if the test came back positive. So that is a big thing to say, that I want to be evaluated as opposed to being tested.
Is there harm in getting treated for Lyme disease if you don't have it? Like, is there a harm in that? I'm just curious. You may not have that answer.
Well, I mean, it goes back to the 80s where they were like, they stopped prescribing antibiotics for everything because they're like, you're all going to become resistant. And then everyone was sick.
Yeah.
All the
Oh yeah,
time.
I remember.
Because they just stopped doing it, you
Like,
know,
oh,
and
you
that's
have a
not good
cough?
either.
Here's an antibiotic. Oh, you're sneezing? Here's an antibiotic.
Oh, they were doing it all the time.
Yeah.
Oh, you have 2 pimples? Here's an antibiotic.
Mm-hmm.
And
They wanted me to be on antibiotics for like preventing of pneumonia, which is common in lupus patients. And I was like, no way in hell am I going to be on a consistent antibiotic for something I do not have.
No,
Yeah.
I mean, I had scores of friends that were on antibiotics for acne.
Yep. So
They
did
were
I.
teenagers
Yeah.
and they did
I
not
mean-
have severe acne. Like, it was crazy how they overprescribed it. So I get that.
So is there a danger? Yes, but knowing your diagnosis can also help you in other ways if you don't want to be on long-term antibiotics, because at least you will have lots of books and other knowledgeable doctors that can teach you how to manage the symptoms, the inflammation. It can lead you down other rabbit holes. Like I just found out that I might have EDS, which is probably one of the reasons why immune system is weak. You know, lots of other things. It can lead you down to why you're sick. And then if you kind of button up those things, it can relieve the actual Lyme disease symptoms.
Right.
But the thing that I always go through with people when my friends go, oh, that sounds like me. Oh, that sounds like me. Oh, I thought that was normal. I make them take the Dr. Horowitz questionnaire. And it's like a multi-system something questionnaire. I can find it. Maybe we can do a link in the podcast later or something.
Yeah, I'd love to do that.
But it basically is like 80 or 90 questions of all the symptoms, from neurological to cardiac to inflammation to joints to pain, everything. And it goes through all of them. And it says, okay, out of 65, you scored 117. Maybe you should talk to your doctor about Lyme disease. Like that, it's like that kind of thing.
Right.
So it, you know, odds are everybody's going to have one or two things. And there's the odds are that a lot of people are going to have like a couple of different things. But if you have 5 things from every column and they're all, you know, chronically every day or 5 times a week, then odds are something is going on. you know,
Yeah.
something connected is going on.
I just asked that because I know a lot of people with EDS are misdiagnosed with Lyme disease, like a lot, because I think a lot of the
Interesting.
symptoms overlap. So I know that several, like you had a very clear tick bite, which led to a Lyme disease diagnosis, but some people haven't. And so the doctors, for some reason, especially in the Midwest, go straight to Lyme disease because ticks are so prevalent. So they go straight to Lyme disease instead of looking at, well, it could also be Ehlers-Danlos, because by the way, I have to tell so many doctors what Ehlers-Danlos is.
Yes.
You know, so sometimes it just depends on what's fresher in their minds. And then later on, a lot of the people diagnosed with Lyme will say, oh, but then I was diagnosed with EDS.
See, that's interesting because they have found Lyme disease as a comorbidity to a lot of things. And it's kind of the chicken or the egg, where if you have EDS and you have connective tissue issues and you have, which causes inflammation and all those other issues, that weakens your immune system. It weakens your flow. It weakens your cerebral fluid flow. It's really a link, and it's kind of really hard to decipher comorbidities because there's been, and again, I'm not an expert. I'm just a person that's read a lot of books, and it's been my life since 2006. So don't quote me on these. I'm not, Google scholar, but I go from medical journals to books, and there's been research done on Alzheimer's cadavers where 100% of them had Lyme disease spirochetes. And it's kind of like, did they really have Alzheimer's or dementia, or did they have untested Lyme disease that got into their brain? Things like that. There has been,
Scary.
there was one, it was really small. So again, like they need more research, but it was like 30 psych patients that got better, that like were healed from their mental illness because they were given dental surgeries and they were on antibiotics for the dental surgery. Like some people with weakened immune system, you have to be on antibiotics 2 weeks before and 2 weeks after. And then your mental illness goes away and you can be released back into society. How often does that happen?
Not that often, but needs to definitely be looked at.
Like clearly the antibiotics did something that has nothing related to mental illness. It's all those studies that there's so many comorbidities that we don't know the chicken or the egg, what came first.
It's so very true. And if you don't have a physician that actually looks at all your systems and is willing to take into, consideration you as a whole, you probably aren't going to get a correct diagnosis. It's going to probably be a long time.
Correct. I decided during COVID that I was going to do a lot of self-care. I had insurance. Everybody had the time. We had more time on our hands from being home and virtual, that I was going to do a lot of my self-care. I've been going to a GI doctor for 1.5 years, and she's ready to pawn me off on somebody else. And that's a specialist because she can't find out what's wrong with me. Things like that.
By the way, that was my GI specialist. I'm fine. I'm looking for a new GI specialist now because
so am I.
Maybe it's a thing there where they can't figure out what's wrong. They don't want to talk to you.
Well, I appreciate it though. I mean, if a doctor says I don't know and I don't think I can figure it out, I appreciate that. I would rather you tell me that and I can move on.
Oh, my doctor wouldn't message me back.
Oh no, I know, but I'm saying in general.
And you've heard me talk about that, But if you're, one of the rheumatologists I saw was like, I think it's EDS, but I'm not a specialist in that. Go see these people who will know more. And that's what I did.
Yeah, I agree with that. But like my doctor literally said, I'm tapped out. Yeah. Like she tested me for maybe 4 things over and over again for an entire year, expecting the results to be different. And after about 1.5 years, she was like, I think I'm going to send you to X because that's pretty my specialty. So I'm, I'm done. I don't have any more ideas. And
but at least she's kind of said it. Like,
I've had doctors say that to me and I'm like, I appreciate it.
Yep.
I'm like, I don't want you to treat me if you're not going to look into it. And I would rather have you be honest with me so I can move the hell on.
Yeah.
I don't want to see a doctor that's not doing anything for me. You know what I mean?
I think it's that they just don't talk to each other at all. There's no functional medicine mentality. So I most recently got sent to a gynecologist from the GI doctor because they're wondering why I'm not absorbing iron and they want to find out if it's a different issue. I was most recently sent to a dermatologist for something, which I think is GI related because it's for a candida type rash, like a skin candida rash, which is also GI related. I have cardiac issues, so I'm going to a cardiologist. But anytime I need a referral to anything, I still have to go back to the PCP and explain to him what's going on. And no one talks to each other. Once you get that referral, My cardiologist doesn't talk to my GI doctor. My GI doctor is never going to talk to my gynecologist about whether or not they thought that's the iron issue. You know, there's no intermingling of departments, and how do you get a full body treatment? And all of those things are EDS. Like, you know?
Like I go to UCLA, USC, and Providence. I see doctors at all of them because I'm trying to see the best doctors I can. Now, UCLA and Providence use the MyChart app so they can see each other's tests and notes and things, but USC does not. So anything that happens with my doctors at USC, I have to let the other doctors know. It's like you become the center of your own care. And I'm like, wait, when did this happen?
Well, it's so hard too. I mean, doctors don't have the time people think they do for the most part. And it really is really hard for them to talk to each other. It just doesn't work that way. I've worked in the medical field for 25 years. I can tell you it's not realistic, but patients need to be better at saying, because I used to see it with patients all the time. Do you have any other doctors? Do you have any other conditions? Yeah, I see some kind of doctor, not really sure what kind. And it was a huge, important deal. And I'm like, you left something out of your care that impacted the rest of your care. You need to know what's going on with your body.
Yes. It's important to know when to tell someone something and when not to. That was the point of the TikTok I did the other day when someone asked if they had to tell their doctor when their last menstrual cycle was. And I said, no, but
it's directly related.
Could impact your care.
Related to the care you need. That's different, you know, in all this wake of Roe v. Wade, people are very concerned, and it's a legitimate concern. And I'm like, you don't have to tell your doctor anything. You don't have to have your blood pressure taken. You don't have to have your weight taken. But if it's something that you're concerned about or related to your care, it's going to hinder you to not.
It is. Yeah, there's a lot of things you don't have to do, but a doctor can also tell you, I'm not going to see you as a patient. And I guarantee you, if a patient walked in my office and was like, I'm not going to give you a blood pressure or menstrual cycle, I mean, unless I was in one of those states, I would say, I'm not going to see you. You need to leave, because these are things I need about you to know about you.
Yeah. There are other things that I didn't realize that I hope might help somebody from this podcast is that doctors don't always ask exactly what they mean. And if you're neurodivergent, you don't know how to answer that.
So true.
So I got not yelled at, but like in my chart, it was like, please note that the patient did not, forego this information earlier. And it was because of the way that she had asked the questions. Yes. So if you're going into the GI doctor for constipation, diarrhea, and malabsorption issues, and she goes, what are your symptoms? I'm going to tell her my potty symptoms. I'm not going to think that the fact that my lymphs don't drain, or that I get migraines, or that I, have a cardiac problem. Like, I'm the patient. I don't see how that relates to the information she needs to know about, did I poop yesterday? I'm just a patient at that point. And I saw her for like 6 months, and then I mentioned my lymph system, and I was like, do you think that could be related? And she got all upset with me that I had never mentioned this dramatic symptom before. And I'm like, how would I know? I didn't go to medical school for 8 years. I didn't do a residency. I don't know what my insides look like except for Google. Like, how would I know that my lymph system might be affecting my whether I have diarrhea? Like, how would I know that?
I take going to the doctor as, I'm going to do a data dump for you, and you tell me what's pertinent and what's not.
Oh, I love it.
Yep, that's what I do too.
Yeah. And so if they're asking me, what are your symptoms? I'm like, do you just want to know what I think are these, or do you want to know everything? Because I'll tell you everything, but we're going to be here a while.
Yeah. I think that's the new way to do it, because I had no idea that when they said symptoms, they wanted to know that your ears ring, like that your ears, but like, I didn't know that when they said, what are your symptoms? Especially if you're going to a specialist. Like, reverse, if I'm going to a cardiologist for palpitations, I'm not going to think that I'm going to tell her I'm constipated, because how would that be related?
But it is. And that's what I think as lay people, we aren't told to do that. Nobody tells you that you should just lay it all out for your doctor, for every doctor you see. And by the way, that gets old after a while too.
Yes.
I'm sorry, the 17th doctor I've seen, and I'm like, all right, I'm going to go down all the things. And
it gets old.
It gets very old.
Yeah, and none of them talk to each other. Even if they have the MyChart and all of the online virtual things, they don't talk to each other, or they don't think it's important. I know someone very close to me that just had a brain scan, and it said that they had a cyst on their brain. Now, you would think that even if it's not important, it's important. Like somebody would mention it.
Yeah.
At least have a conversation going, is there anything else you're not telling me, just to make sure? Not even a conversation. I found this result like 6 months later. And I said, did anyone ever talk to you about this? And they said, no. Did anyone ever mention this to you? They said, no, they just told me it was normal. So we're going to the doctor, and they're going to have an advocate, because they are having symptoms. They're having lots of symptoms that are related to cerebral fluid and brain function and all of these things. And it could be related. And the doctor has never once asked him any follow-up question.
That's so terrible.
Yeah, because I don't think having a cyst on your brain is normal. Here's
most of them are most people have them.
Yep.
I did look it up medically, like medical journals, not just Google, like actual scholar. And most people have them, but if they're asymptomatic, they're fine. But this person is not asymptomatic. They're having left eye issues, headaches, fluid issues, all these things. And I'm like, we need to follow up, because doctors aren't paying attention. They're not paying attention.
You don't have time either to pay attention. And that goes back to the flaws in our healthcare system, is that they have their quotas they need to meet for the day. They have, it's insurance companies and healthcare companies that are run by bureaucrats and businessmen should not be in the business of making medical decisions. And it's terrible. Like, the best care I've gotten is because I paid extra to go to a practice that doesn't take as many patients. So I pay a membership fee. It is worth every penny of that membership fee to scrape that membership fee together to go there, because I get full-blown care from my primary care physicians. Like, they take the time, they look at everything, they read the notes, they follow up, and it's worth the money for me to get that kind of care. I know a couple other people that do it, and they get amazing care from like concierge doctors and stuff, but we shouldn't have to pay that much money just to get someone to pay attention to us.
Nope. But the care in the United States is it's people don't get the same kind of care. It depends on what your insurance is. It depends. I tell people all the time, if you're an HMO or you're a PPO, if you're really sick and you can afford it, if you can afford it, you should not be an HMO. And a lot of times people don't look at me like I'm crazy, and they're like, oh, you don't understand. And I was like, and they do it, they can afford it, but they still choose it. And I'm like, you don't understand how the medical system works. Yeah. And it's disgusting and it's not right, but that's the reality of it.
I just had a friend switch to a PPO because she has discovered she's chronically ill, and she was having such a problem getting referrals to different doctors. And it was getting like, you're already buried under so much medical stuff, and then they have to keep going back. So she switched over to a PPO, and it is much more expensive. She knows she's lucky she can make that switch. Not everybody has that freedom.
Nope.
Yeah. And the issue,
not everyone can afford it.
The issue with the Lyme disease and the other co-infections is how you present it to your doctor as an active infection versus the I forget what they're calling it now, but like the chronic life, I forget, post Lyme disease syndrome or whatever it is these days, more like an active infection. So it really depends on how they write those notes for things like insurance to cover antibiotics or medicines. Because if it's post Lyme disease syndrome, they're not going to pay for it, because that's considered like, that's just how you are now.
Oh, wow.
So with post Lyme disease syndrome, they're saying basically that the bacteria and the other things are gone, and now it's just your body's inflamed and you have to deal with the symptoms, and it's not actually an active infection.
Because, Lyme disease just disappears on people, and, you don't deal with any effects for the rest of your life.
It's really, literally the bacteria is the same. It's not the same. Okay, so it's not literally the same. It's but they're both spirochetes, and they both can break the blood-brain barrier, and that is syphilis. So if somebody was walking around with syphilis and mental health issues and completely deranged, but you gave them their 6-week course of antibiotics, you wouldn't go, oh, it's cured.
right?
Because clearly it's not.
Mm-mm.
So it's that type of thing. And if you look up spirochetes, you'll actually see that they're corkscrew, and they can actually go into soft tissue. They can go through into your organs.
Wow.
It can go right through into your brain. I feel like if I want an eye doctor to put my eyeball under a microscope, because my floaters are spirochetes. Like I can, you know how you can see floaters, and they're all different
Wow.
depending on the person. I literally could draw it on a piece of paper for you and compare it to a spirochete, and it would be the same picture. So
Wow.
they're clearly still active inside my body, you know. And I took myself off. I will never donate blood, even though I can. So Lyme disease is not on the infectious disease list anymore, and legally you can go and donate blood, and they test for babesia, which is a tick co-infection. But if you're negative of babesia, you can still donate blood and give it to somebody else.
Oh my gosh.
And the same thing with organs. Like if I had an organ donor card, they would take all of my organs and put it in somebody else. And I bet you buttons that they'd be sick in 5 to 10 years.
Wow.
It's crazy.
I
It is
agree
crazy.
with you.
Yeah,
So
yet
I made
gay
sure that
people
I
can't donate
rescinded
blood
all
just
of my.
because they're gay.
Yeah, I rescinded all of my organ donors. I've never given blood. I refuse, because I don't want anyone to have this unpredictable hell. Because then how would you even diagnose this if you got it from a transfusion or you got it from an organ? How would you explain that to a doctor? They don't
Very
believe
true.
us. They
That's
don't believe
right.
us, and we have the tick bite. Like,
Yes.
how would they believe somebody that got an organ?
Yeah.
Right? And
You
by the
know?
way, they're not even going to look for Lyme disease. That's the other
Exactly.
thing. They're not.
Exactly.
That's not even
So-
going to be at the forefront of what they're thinking if it's an organ donation or blood transfusion. That's so far from what they're thinking it could possibly be.
And all these
Correct.
people potentially walking around out there with these undiagnosed diseases because
Yeah.
no one thinks to think about this could be Lyme.
Yes.
Yeah.
And when things like on the news go about like West Nile virus, when that was really big with mosquitoes. And I remember being in New York, it was still New York, it was the local channel news. And the doctor that I was seeing for Lyme disease, his office was 100% always full. Every single time I went in there, full, waiting room full, rooms full, people on IV therapy full. And the news was freaking out about 9 people in the hospital with West Nile virus, you know, mosquito season. And I'm like, are you kidding me?
See,
Like, why are we not talking about the broader picture of an
Yes.
endemic?
But
Like, ticks are an
I
endemic.
feel like in Chicago, they almost do at least a couple news reports every summer on Lyme disease and
Yeah.
tick-borne illnesses.
We do.
Yeah,
Yeah.
it's more frequent to talk about there. I think
It is.
there's just
Yeah.
such a prevalence of ticks from that area. But here in California, I almost never hear it.
Mhm.
Yeah,
It's everywhere.
They're focused on West Niles, Zika, whatever it is, and those type of things. Excuse me, but they're not focused on Lyme disease at all.
No, and there have been towns that have become sicker. Like an entire generation is coming into their local country doctors and they look it up. The doctors really try to figure out what's wrong with their town, because it would be 30, 40 people in a July coming in with all these crazy symptoms. And he found out that it was Lyme disease, and they were trying to
Wow.
figure out what changed. And there was a new migration pattern where a local lake had dried up, and all of the birds were now landing in their town as they migrated to Canada and then would migrate back. And they were actually bringing ticks into the area. So there had never been a tick population there, and the migration pattern of birds had changed. I mean, this is how ridiculous people are. How can doctors follow this? Like, we're talking like fly, not to insult anybody, but fly over cities. Like, we're talking about like mid-United States that have never had tick issues. And random flocks of birds are introducing it into the population.
Oh,
And
that goes
how
into
do you
climate
educate
change.
that?
Like you
Mhm.
see the random effects of some of the decisions our predecessors have made, and some decisions some of our current political persons have made, and it goes beyond just, oh, we're going to lose some trees or damage this land. It's changing everything for everyone. Like,
Mhm.
exactly. The lake dries up because of climate change, changes the migration of birds.
Mhm.
Now people have Lyme disease.
Yep.
So, yeah, but no one talks about that part.
No, it's birds, it's rats, it's any animal that can have a tick can move it from one location to another. So you know, people in New York City, they have rats, they have mice. It's all the same. You don't need a deer, you don't need a dog, you don't need grass. Anywhere that the animal has blood and is warm blooded, that tick is going to find them because that's its meal. That's its, yeah.
Wants your blood, little vampire. Oh my gosh. Okay. Well, we are kind of at time. So is there anything else you want to share with everybody out there?
I just want to validate everybody that thinks that their chronic pain isn't valid. And people go, oh, I lose words all the time, or, oh, I get headaches, or, oh, and they kind of poo-poo it. You don't have to be in pain. You can seek things out even without a diagnosis. You can get a massage, you can go to physical therapy, you can do things if you're financially able to, or figure out a way, you know, sell your soul to Etsy. I don't know, but just, you know, like your own journey to get to where you can be to survive, because you don't need a doctor to tell you that you're sick if you know that you're not well. And that's it. And just be well.
Yeah. Do as much as you can that doesn't need a doctor's intervention. Mm-hmm. And it does help a little. Yeah. But I get it. All right. Well, thank you so much for being on the show. Yes. And this was fantastic. I actually learned a lot.
Yes, absolutely.
So we appreciate you coming on, and we appreciate the information you are passing on to our listeners, because I, again, think that Lyme is oftentimes just considered a illness you get after a tick bite and then you're all better. And that's just not necessarily true. So I do appreciate you taking the time to come on and talk to us about this.
Absolutely.
Thank you.
And we'll invite you back anytime.
Absolutely. We've got so much to talk about. We
I know. I know, it's like, well, we have enough for a podcast every week. And then we're like, no, there's endless.
I think you're good.
All right. Well, thank you so much. And everyone listening, have a great week.
Have a great week, you guys.
We appreciate you guys listening. Thanks.
Bye.